No one should be forced to seek primary health care in an emergency department or acute care setting.
Primary Care Alberta. That's the name for the new agency that will be responsible for the administration of primary healthcare services in Alberta. Health Minister Adriana LaGrange making the announcement Tuesday, saying the new agency's aim will be to make sure that Albertans all across the province will have access to high-quality primary healthcare services. Along with the new agency is a new CEO, Kim Simmons, the current Assistant Deputy Minister of Strategic Planning and Performance at Alberta Health.
Having a CEO that oversees primary care, making sure that we have the right resources, the right facilities, and the right locations, working with the primary care networks across the province.
That they belong to a health home where they don't have to tell their story over and over.
And while Simmons brings the experience of working with stakeholders across the healthcare system, some are not quite sold on the new agency.
We know what it wants to achieve. I think we're not entirely certain how it's going to achieve that.
Dr. Shelley Duggan with the Alberta Medical Association says while the AMA is willing to work with the provincial government on the move to Primary Care Alberta, without a finalized new compensation model for family physicians to keep them working in Alberta, they won't see the improvements in the healthcare system the government is hoping for.
We need to have patients go to their primary care physician, for preventative care. Also, to help manage their chronic illnesses. We need to keep people out of the emergency department.
The move is part of the provincial government's push to decentralize Alberta Health Services by creating 4 different agencies focused on primary care, acute care, continuing care, and mental health and addictions. The creation of Primary Care Alberta comes after Recovery Alberta, another agency created to take over a portfolio once managed by AHS to oversee mental health and addiction services in the province back in September.
We don't know if they will continue to be members of Alberta Health Services, or are they going to be employees of Primary Care Alberta.
We saw with Recovery Alberta a very bumpy, delayed rollout that's still ongoing. Workers didn't know who their employer would be. Their email addresses didn't work in the morning. There was all these issues with that first sector rollout. Yet here we are pushing forward with another one.
The health minister says Primary Care Alberta will be up and running by November 1st. In Calgary, Djan, City News.